Thank you for that fantastic weather report, Janine. I'm definitely loving this cooler weather. Now, on to our next story. We're going to be talking about different types of treatments you should be incorporating into your patient's plan of care for Parkinson's disease. Now, Parkinson's disease is a degenerative disorder that affects dopamine-producing neurons in a specific area of the brain called the substantia nigra. Symptoms generally develop slowly over the years, and these symptoms may include tremors, problems with gait, and balance difficulties. Now, on to Shannon to talk about the aerobic interventions reviewed.
Aerobic activity has been known to improve fitness, executive function, and quality of life in those with chronic disease. Aerobic exercise also evokes dopamine release and improves its function, which is important because dopamine is the basis for motor movement in patients with Parkinson's. Other experimental studies test aerobic exercise by some form of walking or cycling on a stationary bike while tracking their aerobic goals via heart rate and VO2 max. Some even incorporate Nordic walking styles and virtual reality. Results have shown that these interventions are completely feasible for patients and can decrease fall risk, increase executive function, improve walking economy, and increase participation in abstract learning skills. Now Josh will go over some resistance training with you all.
All right. Well, researchers have found that progressive resistance training had better outcomes than the currently recommended program. Progressive resistance training showed higher improvements in muscle strength, velocity, and muscle activation. Further studies used EMG to look at the effect of instability resistance training in comparison to normal resistance training. The study found that the addition of instability to the intervention could potentially increase sensory activation and overall cortical activity. These findings suggest that progressive resistance training could be a good candidate for replacing the currently recommended therapy. Now on to Coral to talk about alternatives.
Well, in other news, several different methods of therapy are currently being administered. Among the most popular of these are LSVT big therapy and high balance therapy. Studies that compared these two methods of therapies among other forms of usual treatment have found that LSVT big therapy was the far superior form of therapy for these patients. It's important to note that there are several components of the LSVT therapy, aside from the big portion, that focus on other symptoms and issues that PED patients present with. Other research is being conducted to see if more alternative forms of treatment, such as dance and music therapy, is effective in the treatment of these patients. Looks like your grandma making you dance at those family events was really a form of therapy, huh, guys?
Oh yeah, my grandma will definitely be walking better after trying some of these interventions.
Oh yeah.
Yeah. Well, for more information on this story, you can check it out on the UCF DPT research page on our website. Now back to you, Matt.